Good morning. This is Solomon Jones on 900 AM, 96.1 FM, WURD. And we are, of course, live at the White House complex in Washington, D.C. And we are speaking to a number of people from the Biden administration, including Vice President Kamala Harris a little bit later on today. Right now, we have the pleasure of speaking with Loyce Pace. She is Assistant Secretary for Global Affairs from the Department of Health and Human Services. Ms. Pace, good morning.
Good morning. How are you?
I'm good. How are you?
I'm doing well. Thank you for having me.
That's good. So what does your department do in global affairs at HHS?
So a lot of people might not realize that our Department of Health and Human Services has this global arm. We do a lot domestically, obviously, as a large agency or department, but we have this global office really to think about the best ways to harness what people are doing around the world in a way that helps Americans here at home.
Mm-hmm. Mm-hmm.
And so we have a lot of exchanges that we do with countries around the world, a lot of ways that we're showing up in different dialogues with other governments who are dealing with some of the same issues. And it's really important, especially when we think about health disparities, the ways that we can be showing up in these other spaces and,
Sure.
again, learn those lessons.
Yeah. Well, there are a lot of lessons that we need to learn. I know you worked on the COVID pandemic. Of course, it killed over 1 million Americans, more than 3 million people worldwide. You worked on the Biden-Harris transition team, and that was your focus there. What did the pandemic teach us, particularly about how race impacts health outcomes?
Yes, like you said, we lost a lot of lives here domestically, and we lost that their community-based programs and services, their health workers, the people who are really showing up for each other. We're really there to say, okay, this is what we can do in this moment when no one else necessarily is going to be able to dive in and save us.
I would think that they learned a lot, given some of the other pandemics that they've dealt with, Ebola and that sort of thing.
That's right.
That they could apply when COVID came along.
That's absolutely right. So you have, as you said, issues like Ebola, which was a real lesson for West Africa in particular, but Ebola has hit countries like the Democratic Republic of Congo. And what's really beautiful about this story is there are many ways that the U.S., including our office in the Department of Health, has worked with these African and other countries around the world to get to that point, to get to the point where they could say, okay, we have health workers who stand ready to respond either to Ebola or to COVID or to whatever comes next.
Yeah. And that is my question. What is coming next? Is there another pandemic on the horizon? And has the Biden administration followed the Obama blueprint and left instructions just in case?
Yeah, that's a really great question. I mean, if I knew it was coming, then I would certainly be the first to tell you. But the reality is we don't know what's coming next. And you're right, we have to be prepared. And what's great about the work that we have been doing out of our office is the ways that we have been trying to work with organizations like WHO or the World Health Organization, and these other countries are all over the world to say, all right, what have we learned, right? What did we get right? There were many ways that things worked well. We exchanged information and data with countries real time. We did manage to get vaccines to countries all over the world. And we know that some of that felt it came later than it should have. And so we're even working towards saying, okay, the next time this happens, if it does happen, what can we have in place to be sure that we're building on these success stories, but also improving on ways that we might have fallen short? were able to line up for this vaccine. And I was really happy that we were able to work with community leaders, faith leaders, political leaders to make that happen. Again, not just in the US, not just where I'm from in Los Angeles, for example, but Lagos, Joburg, Barbados and elsewhere. So, again, as you're saying, there are plenty of ways that we can say, how could we have gotten that even more right than we did? And how can we ensure that people don't feel left behind? Because that's something that hits me hard, having been a community leader myself, right? I haven't been in government my whole career. This is my first time in government. And, when I'm doing this work, I really think back to the faces and voices with whom I've interacted over my 20-year career. And frankly, who I was and who my family has been in this too. I think we all have these very personal experiences when it comes to COVID or anything else.
Sure. So then that gets to the vaccine hesitancy, right? And it goes back to information and how information is disseminated and what people believe and how government can be more nimble. I didn't think, as this thing was happening, well, you had another administration, they had a whole different approach. Let's act like it's not real. But in terms of getting information to people about the vaccines and their efficacy, what did you learn about that?
We learned a few things, honestly. We learned that messengers matter, and that's just tried and true public health. So who shows up to say what to whom is everything. And you have to work with trusted leaders, right? And not just leaders in this very traditional sense, but anyone who's showing up with the right message and with the right heart to give that message is a person that I want to be working with. So that's thing one. Thing two is being really honest about what we don't know. And I think that was really hard for a lot of public health professionals, a lot of people who pride themselves on being expert and frankly are looked to as experts. But I think in our most honest, effective moments, we could step back and say, goodness, there's a lot we're still trying to understand. So what we do know right now is that this is working, right? And this is why we'd like you to move in this direction, with these protocols, with these other point, right? And I think that is the hard part of COVID and other parts of public health is when we ask people to analyze the information for themselves to some degree and take the steps they feel they need to take. There's some people who feel comfortable, especially now that they're vaccinated, to move freely. And I think that that's important and okay. And then there's others of us who, need to be a bit more cautious or careful. And that's, and we can coexist. That's the beauty of this too.
Yeah. Now, there was a large global vaccine study that just came out that talked about people who took the vaccine having small increases in neurological, blood, and heart-related conditions. Are you familiar with that study?
I'm not familiar with that study,
Okay.
actually.
So that came out, and I did talk with some doctors about it. They said that it's a small risk, but the risk is there.
Yeah, it's important to keep gathering information on the effects of any vaccines, not just COVID vaccines. It's one of the reasons why we think in my office and in this government, it is so important to continue working with World Health Organization, who is very closely tracking this. I mean, it's one of the greatest studies that we can have in public health, arguably, given everyone around the world was affected by COVID. And so we'll learn more and more, but it's to be clear, the vaccines are still safe and effective based on the data that we have, and we'll continue to operate with that in mind and again continue to study what else we might want to learn from this experience.
Cool. Well, let's talk about some stuff that's happening internationally. So Israeli raids crippled the Gaza Strip's second largest hospital last week. It wasn't the first time. The wars killed about 29,000 Palestinians, mostly civilians. And Israel has repeatedly targeted hospitals. My question to you, what conversations is your department having with your international counterparts about the health crisis that this is creating, and are we doing anything about it?
Yeah. So I think the president and hopefully the VP, you've heard talk about this. One thing that we're able to do in the Department of Health is work with other health secretaries, or often called health ministers in other parts of the world.
Hmm.
And we have been able to actually sit down with them and understand what we all could be doing collectively to really shine a light on what's happening to Palestinians right now or in other conflict zones.
Yeah.
Um, the one role that I have been playing is I've been able to sit on the board of the World Health Organization. And there was a session the end of last year where the Director General, Dr. Tedros, really implored people around that table to think critically about what's happening in Gaza, but also in places like Ukraine, Ethiopia, Sudan, Haiti. I mean, the conflicts are really causing a problem,
Right.
and increasing people's risk of poor health outcomes all over the world.
Mhm.
And it's important for us to acknowledge that. And I
Right.
think as health leaders really show up for those people who are suffering under the weight of those conflicts. There's an African proverb, I think, that says, when elephants fight, the ground beneath them or the grass beneath them suffers. And I think
Mhm.
that's what we're seeing play out. And importantly, we can hold both. We can acknowledge that the terrorism that led to this conflict is atrocious, and
Mhm.
that there's civilians
Yeah.
who we need to help in this moment.
Mhm. Yeah, I'm glad that you mentioned some of the other conflicts. Of course, the Democratic Republic of the Congo has had an ongoing conflict, millions of
Yeah.
people killed. We don't hear
Mm-mm.
anything about that. We don't hear much about Sudan, the other conflicts that you've mentioned. What are the health effects of having these
Yeah.
kinds of conflicts where millions of people are dying?
Well, this is something I really appreciate you asking about, because health is not just about, the ways people are in and out of hospitals or clinics, or, we have to really address health in all these different contexts now.
Yeah.
And conflict in particular is causing so much. So if we look at the situation in Gaza, for example, there's food insecurity,
Mm.
there's a lack of access to clean and safe water and
Yeah.
sanitation. And then, of course, there's the mental health effects, right? I mean, we've spoken to leaders from these countries who really ask, okay, well, we have a lot of trauma kits, and we have medical professionals showing up to help, but what do we do psychologically for these people who are
Right.
enduring this, not just
Yeah.
for months, but for years?
Mm. Yeah, it's a lot. It's a lot to deal with. And I want to thank you for joining us
Sure.
this morning. That's
Yeah.
Loyce Pace. She is Assistant Secretary for Global Affairs in the Department of Health and Human Services. Thanks so much.
Thank you.